Welcome to this first ever remote episode of the Be Ready Utah PrepCast. I'm Wade Mathews, the Be Ready Utah manager here at the Utah Division of Emergency Management. Joining me today are Kevin McCulley, the Preparedness and Response Director for the Utah Department of Health and also COVID-19 Unified Command, and Charla Haley, Director of Communication at the Utah Department of Health. Thank you both for joining me today.
You're welcome. Thanks for asking.
Great. And good morning to you, Wade and Charla.
Good morning.
Hi, Kevin.
Yes, safe at your office, and Kevin and Charla in the Department Operations Center. We want to know that we are observing the protective actions, social distancing, staying away from other people. So thank you for joining us remotely today.
You bet.
First, let's take a moment and reflect a little bit and share your thoughts about just this historic event, this historic pandemic that's affecting the entire world, our lives, the economy, health, everything. What are your thoughts about what we're going through right now? Kevin, let's start with you.
Well, the thing that is most unusual to us is the scope and scale of this response. Since 2002, many of us, yourself, Charla, and myself, and many others have been doing this work in public health and medical emergency preparedness, disaster response. Folks probably recognize that pandemic is a part of the overall all hazards planning that we do. We spend a great deal of time planning for earthquakes or other natural events. Unfortunately, we spend a lot of time planning now for intentional events. And additionally, we have been planning for decades now for pandemic. The thing that makes this one different, in addition to the scope and scale and worldwide nature of this event, has really, a lot of it has had to do with the shortage of PPE that occurred right out of the gate from this response. And then secondly, because there are no medical countermeasures, it makes for some challenging situations. Be aware that even in H1N1, we didn't have a vaccine initially, but there were some effective medical treatments that were available. In this case, we have limited evidence of any medication that's particularly useful for this response. We're still waiting for some amount of time until an appropriate vaccine is developed. So what that actually leaves us with is really the only way to treat this is to provide physical separation of people who are ill and people who are not. And as I talk a little bit more, we'll see how that's playing out in terms of our response to this event.
Yeah, go ahead, Charla.
Well, I was just going to say the thing for me is I've worked for the Department of Health since 2006 and been involved in the communications planning efforts for the Department of Health. And this looks so different than what I thought it would be. I mean, it is so much more demanding than I ever even considered it might be. The behind the scenes work that the communications team here at the Department of Health is tasked with is phenomenal. And there are 3 of us, and we've pulled in another person, so there's basically 4 of us, and we're doing so much more than I could ever comprehend. We are putting in 12, 13, 14-hour days here, oftentimes 7 days a week. And it is incredibly demanding. And I didn't really anticipate it would be such a drain on our system. The people on the front lines are, you recognize what they're doing, but those of us who are working behind the scenes, it's, we do a lot behind the scenes that never is noticed, because we're back here behind the scenes doing our jobs. And it's very, very challenging, and it's hard not to let it get to you. You have to take a mental health break and stop and regroup and reorganize and think about what your priorities need to be. Every single day, we have to sit down and talk about what we need to do that day.
Yeah, and that gives me a moment to think, and I should thank you both for what you're doing. You both are very critical in this whole overall Utah response to this worldwide pandemic and historic situation that we are in. And a thought occurred, Kevin, as you were speaking too, is contrary to what all these conspiracy theorists are saying and thinking, this really is a legitimate, serious worldwide danger, and that has required the response that we have been giving it as well.
Absolutely, absolutely.
Yeah.
And that just lends to the unknown situation, the uncertainty of what's going to happen. We've never seen this before. This is a brand new virus. We've never seen it before. We don't know how it's going to behave. People keep saying things like, "Well, once it warms up, will it decline?" And we don't know.
Right.
Possibly. I mean, but you're still seeing a lot of illness in areas where it is starting to get warmer. We
Yeah.
don't, we just
You
don't know.
we've heard this phrase many times too, the new normal. But I'm afraid in this situation there really will be some long-lasting, if not permanent, lasting changes around the world because of what we've been going through with this coronavirus. Kevin, you talked about right out the get-go, one of the issues that you faced in Unified Command was the lack of PPE. But I want to just maybe talk a little bit about, I like how you described your responsibilities over space, stuff, and staff. Can you talk about that a little bit? What are you doing right now with the Unified Command?
Sure, and just to reflect on it just a little bit more in terms of the purpose for the Unified Command is most health and outbreak responses are typically managed within the Department of Health as the lead for the Emergency Support Function 8, the health and medical component of a response. Our UDOH team actually activated, I think, on the 21st of January. Right? So we've been in it nearly 3 months to the day today, but this thing so quickly blossomed and bloomed and got bigger and bigger. We were very welcoming
Right.
and so fortunate that our leadership in the state agreed that this unified command could provide great benefits. In terms of your specific question, space, stuff, and staff are traditional elements used for health and medical disaster planning. And I know we don't have a lot of time, but let me just talk about some key issues. A lot of the way that we look at this response is we're trying to address what's going on now, but good emergency management means that you're always keeping your eye down the road. What is the future? We know that a lot of the modeling has variable periods and durations of maximum medical surge. And even though we may not be able to know the exact day or the time or the number of patients that might present in our healthcare systems, we continue this future planning around the space that might be needed to treat patients. So for example, we're working very closely with our hospitals. Many of them are currently engaged in doubling or even tripling their ICU capacity by putting multiple patient beds in one room, identifying non-patient care spaces for the treatment of patients, and certainly looking at the systems that are in place to ensure good care, even if that hospital is at or near full. Additional elements of future planning on space includes the identification of non-hospital or out-of-hospital care locations. For example, just last week, we confirmed an arrangement with a local long-term care facility that actually agreed to discharge all of its patients to allow hospitals to use this facility as a post-acute discharge location. That means once COVID patients are out of their maximum need for care, they still may need convalescent care. And rather than continuing to take up a bed, we've made this arrangement with this long-term care facility to allow for that hospital decompression. As we walk down each of the steps or levels of out-of-hospital care, we go through various iterations that could include the use of hotels, the use of non-healthcare facilities, and as we get to really what is our most, our area of care of last resort, people have probably heard about the work that we're doing at the Expo Center in Sandy. And that again talks about that continuum of care that might be needed for people if and when this surge may arrive. There's
Yeah.
another area that I wanted to talk about, and that again has to do with the supplies. We noted right from the outset that we have experienced a pretty significant impact to the personal protective equipment supply chain across the globe. And in order to appropriately respond to that, through this unified command in partnership with many state agencies, not just health, but UHP, public safety, Division of State Purchasing, Division of Emergency Management, we've basically created a supply chain company to look at mitigating these shortfalls. That includes donations from the public and from industry, purchasing and requisitioning from across the world, and certainly looking at distribution models, working in partnership with private sector to get whatever PPE we can get to ensure that it's appropriately distributed to all the stakeholders across the state. The end result is that it may never be enough because we're in this global shortage, but we are making every effort to acquire PPE through any means necessary. The final area I wanted to talk about briefly has to do with the third critical component of ensuring healthcare delivery, and that's appropriate staffing. And we have seen our healthcare partners have stepped up, providing things like ensuring that folks are appropriately trained, that they're able to work on schedules that is going to save their time and their energy for when this medical surge does occur. We've actually even sent, Intermountain has actually sent healthcare workers to New York to support their immediate need, understanding that we may be relying on other states to support that healthcare workforce when we start to see a medical surge here. There are two other pieces with that that are critically important. One is working in partnership with UServe Utah and the Commission on Volunteers. We have put out a call for willing healthcare volunteers. In less than a week, over 400 individuals have signed up indicating that they want to be a part of the staffing solution. And the final piece I wanted to mention is, again, Utah is a very pro-volunteer state. We have very high levels of volunteerism and people willing to step in when the time is needed. And so we've worked very closely with our local health department, Medical Reserve Corps, and other volunteer groups across the state to start to identify potential missions, pre-credential and pre-screen these volunteers, and ensure that we could activate staffing support if and when it's needed anywhere in the state of Utah.
Absolutely. And a great explanation of all the moving pieces and all the different areas of concern that are making our response a success here in Utah. And I've got to say, I think Utah is doing a great job of managing this in comparison to some other areas around us, around the nation, around the country, thanks to the great efforts of Unified Command and the task force and the Joint Information Center and all of those different pieces. What I'm hearing too, though, Kevin, and Charla, I'm going to maybe direct this to you, is that we're not out of the woods yet.
No,
you know,
oh gosh, no.
Everybody is really getting tired of the cooped up at home, if you will, the stay at home. But those things still need to be in place in order to continue to keep us safe and get us through to the other side of this, right? Charla, what are the things that we still need to be doing?
Keep social distancing. Keep limiting how many people you're around. No more than 10 people in one place at a time. It's best if you keep to your family and use your family as your outlet, and wipe down everything. I've turned into a germaphobe since all of this has started. I wipe down everything. You cannot be too careful. And excuse me, the big piece is wash your hands. I don't know what people were doing before, but people have finally started washing their hands. This has been a message that the Department of Health has been trying to get out for years. And we even did a video during, gosh, I forget what it was.
It was hepatitis.
Oh, the hepatitis A, that's
Yeah.
right. Where I was the person who was in the bathroom who didn't wash her hands. And I felt really terrible having to do that. But we just really wanted to get that message out there, how important it is for personal hygiene. And so keep doing all of those things. And yes, wear a cloth mask when you're in public. That
Yeah.
is the best way to protect yourself right now.
And it is really, Wade, for a lot of individuals, it is really that reinforcement of core public health measures, as
Right.
Charla alluded to. We do this during flu season. We do this when there's a disease outbreak. So these items are certainly not new. I think the idea is, again, the scope and scale becomes a bit overwhelming. And as we've seen with plans to start to open up various parts of our community, it maybe allows us to take an approach that is less like a sledgehammer or a big giant switch where you turn everything on and off,
Yeah.
but it's actually to engage in targeted public health interventions. Maybe there are parts of Salt Lake County or places in the state that are seeing higher rates of disease, of case increases. And rather than just shutting everything off at once, we can apply targeted interventions, increase testing, wraparound services, out of home quarantine housing, and certainly the traditional case management and active monitoring that public health does very well, but just a little more specifically defined than it has been during this initial response.
Well, and you have to remember the public piece to all of this, and that is that people are dying. And that's really hard to watch. Sorry.
No, you're absolutely right. And that's something we absolutely need to acknowledge too, is
Yeah.
there is death happening. There is sadness involved in the loss of life here that
Well, and
would
the
not have occurred had COVID-19 not occurred.
and the
Yeah.
heartbreak is people who are the most vulnerable, those in nursing homes. They're kind of sitting in a pool of infection sometimes, where that you get one person sick, the wrong person comes in to visit and brings in the illness, and then all of a sudden you've got a whole facility where people are dying because they were all exposed to this one person who didn't know they were sick at the time.
Yeah, and most likely a younger person. And
Yeah.
we talk about the high risk, but I'm hearing numbers, and you can help me understand or explain this a little bit more. That there's even a greater impact or a higher number seen in the 24 to 44-year-olds, even though they may not have the highest illness
Yeah.
or death rates. They're having the highest
Well,
positivity. Is that correct?
and we're still trying to understand exactly when someone who's been exposed to it is most likely to spread it to other people. And in some cases, you may not know that you're sick. And you could very innocently go to a family gathering, and the people who are most at risk of getting it, the elderly people or the people who are immunocompromised or have other underlying illnesses that make them more susceptible to this, they get sick then when you didn't even know you were sick. They get sick by being around you, and the next thing you know, they're in the hospital on a ventilator, and many of them don't make it.
Yeah.
Yeah. Um, Kevin, your analogy too about the light switch and so on, and everybody's saying let's start flipping the switches back. But I think we have to be careful. Just like an electrical surge, you can't turn everything on all at once without risk of blowing the system, blowing the breakers.
Well,
Same
the
thing with this,
governor,
right? We don't want,
the
if we turned everything all at once, we could have another big outbreak,
yeah, and
possibly, right?
the governor's been really careful about saying he wants to base his decisions on science, not on emotion.
Yeah.
So we have
Yeah.
to really watch the signs and the figures and the data as it comes in, and be ready to respond appropriately when it's time. And that's where all of the modeling comes into play. People are trying to predict when we'll peak. And, we our state epidemiologist always says we need at least 2 weeks of good numbers to understand what exactly is happening. And until we have 2 weeks of numbers that are declining, we're not ready to do anything. We just have to keep watch and wait and do it when it makes sense.
And Wade, this really points to that idea of we have issues today that we're working on mitigating. As noted, Charla noted that there are vulnerable populations that are currently disproportionately bearing the impact of COVID, even in the state of Utah.
Right.
But we also have to keep our eyes down the road in terms of we're going to prepare for the worst, but hope that our interventions have been successful enough not to cause secondary surges down the road where the sledgehammer then has to come back out. Because I talk to many small business owners, and we completely understand the devastation that shutdowns have caused. And it's not a sustainable model, but it is that balance between the economic realities and the public health realities that fortunately our leadership, our governor, lieutenant governor, they are able to listen to both sides and understand that there's a path, that a tightrope that needs to be walked, because both of those are critical issues for the state of Utah.
Yeah, exactly. And I understand both of your time is very valuable, and we want to allow you to be able to get back to work here and answer your demands at this point. But maybe just a final question for both of you. What are some success stories maybe you've experienced through the response so far, through your specific responsibilities, or final messages that you'd like to share with the public at this time? Charla, let's go with you, and then we'll come back to Kevin to wrap that up.
I think the biggest thing and the biggest the lesson that really hits home with me the most is that as much as we like to think the Department of Health could have responded alone, we can't. It was just too big. It's been too big. And I'm so grateful for everybody who's come in and stepped in, for you and Joe and the Joint Information Center. We could not have done this alone. We tried for that first month. We tried to make everything work, and it just grew too big for us to be able to handle everything. And the governor's office and everybody who stepped in to help us, we have had so much help on the communications level. It's been amazingly helpful. We just couldn't have done it alone.
Absolutely, and thank you for that. And I think that was something that will be carried forward to anything future to
Right.
this scale, the teamwork and the coordination and networking that has been
Yeah.
reinforced through this
Right.
response.
Right. And
Exactly. Thank you.
I'm sorry I get so teary, but it's like I feel so passionate about all of this because it's been an amazing experience.
Yeah, and thank you for all that you're doing too, Charla. Kevin, last words of wisdom, success stories, or any messages that we need the public to hear at this point.
Sure. Again, three things come to mind for me, and one echoes what Charla said, and that is this understanding of, even though this is a health forward response, it's really an outbreak management response. The activation of the unified command really created this whole of government response. I've worked with more people over the past 3 weeks than I have in the past decade in preparedness and response. And now we are all focused as a whole of Utah to mitigate and to respond to this event. Looking back on it, would we have recognized that it would have gotten this big? We would have requested to go into unified command from the very beginning.
Mm-hmm.
And absolutely, that'll be a lesson learned for us. The second thing is the call to actions to the public in Utah have actually been tremendous, whether it was the call for the volunteers that I mentioned, the call for donations of personal protective equipment, the call for folks to build their own masks and distribute them to people that are needed. That has just been an amazing opportunity and a win for us, is that we've been able to target the needs into directed actions rather than just say, hey, everybody, bring us what you got. We're actually able to work on that and see great benefits from that. And then finally, it probably goes without saying, but the unified command would have not had anywhere near the success that we've had it not been for our private sector partner engagements.
Right.
Whether it's Silicon Slopes, whether it's the Utah Manufacturers Association, or whether it's the hundreds or thousands of unnamed private businesses that have stepped up to actually offer their people, their supplies, their time, and their expertise to actually get us through this. And so we're certainly not anywhere near the finish line on this response, but knowing that we have the whole state of Utah, public, private, and individuals standing behind us, it gives us that push to keep moving forward as we prepare for whatever's next on this response, and then whatever is down in the future in terms of, other threats. As we've seen, earthquakes apparently still happen during pandemics.
Yeah.
So we continue to move forward under that all hazards model, and now we see the resources that could be brought to bear.
Mm-hmm.
Absolutely. And Kevin, I'm with you, Charla. I'm getting a little bit teary talking about all the pieces and all the support and everything that's made this work so far. And I want to just kind of finish by saying, if I could choose some place to be during this situation, I couldn't choose a better place than Utah.
Exactly.
The best place we could have been during this situation.
Absolutely.
So, and it's thanks to you folks like you and your teams as well. So, again, thank you so much for being here, taking a little bit of time away from your busy schedules. I know how busy you are with these responses and your efforts and responsibilities, and thank you for those efforts.
Thanks, Wade.
Yeah, absolutely. Thank you both.
Thank you.
And that's gonna wrap it up for us here on the Be Ready Utah PrepCast. Thank you for joining us. Again, please look for all of our PrepCasts on the Be Ready Utah YouTube channel, on our social media, Twitter and Facebook. Share these, help spread the word, and continue to do what we can to flatten the curve and bring this to an end a little bit sooner. And again, thank you for watching.
Hey, hope you enjoyed this episode of the Be Ready Utah PrepCast. Like what you're seeing? Have a question about anything related to emergency preparedness? Or do you have a comment about something you've learned as you make a plan or get a kit? We'd love to hear from you. Comment or reply to us on Twitter or Facebook at Be Ready Utah with hashtag BRUPrepCast, or in the comments on YouTube. We'll talk about it on one of the next episodes of the Be Ready Utah PrepCast. Don't forget to share these videos and your own adventures in preparedness with your friends, family, neighbors, and coworkers, because anytime is a good time to talk about emergency preparedness. See you next time.